അനിൽ സാറേ.
സാർ
ആ
സാർ നമ്മളൊരു കുറച്ച് പേര് എനിക്കൊന്ന് എന്തോ ടെക്നിക്കൽ ഡിലേ ഉള്ളത് കൊണ്ട് ഒരു ക്രൗഡ് ഉള്ളതുകൊണ്ടാണ് സാർ. നമുക്ക് അല്ലെങ്കിൽ ഇനോഗ്രൽ ഫംഗ്ഷൻ തുടങ്ങിയാലോ സാർ? അങ്ങനെയാണെങ്കിൽ തുടങ്ങാമല്ലോ സാർ.
Good evening, and a warm welcome to everyone present here. Myself, Dr. Amna Gafur, House Surgeon of Kaumara Britya Department at Government Ayurveda College, Tripunithura. We are delighted to have you join us for the national webinar series being held as part of the World Breastfeeding Week 2025, observed globally from August 1st to 7th each year. This academic initiative is jointly organized by Kerala University of Health Sciences, School of Fundamental Research in Ayurveda, in association with Department of Kaumara Britya, Government Ayurveda College, Tripunithura. In accordance with this year's theme, prioritize breastfeeding, create sustainable support systems, integrating Ayurvedic wisdom across maternal stages. We focus on supporting mothers throughout antenatal, natal, and postnatal periods using Ayurveda's holistic principles. Over the next 5 days, we will hear from experts across the country on Ayurvedic dietary practice, herbal support, yoga, and more, all aimed at strengthening maternal and child health. We thank you for being here and look forward to meaningful learning and discussions. To formally open today's session, I now invite Dr. Anil Kumar MB, Professor, School of Fundamental Research in Ayurveda, KUHS, and our organizing chairman to deliver the welcome address. Sir, we warmly invite you.
Thank you, Dr. Amna Gafur. Respected Pro Vice Chancellor, Honorable Dr. C.P. Vijayan sir, Dr. S. Gopakumar, Registrar of Kerala University of Health Sciences, then Dr. C. Sindhu ma'am, the Principal of Government Ayurveda College, Tripunithura, Dr. Noble T.M., the representative of the Teachers Organization from Government Ayurveda College, Tripunithura, respected Dr. Dinesh K.V., keynote address will be done by sir. Then Dr. Reena Kulkarni and Dr. Shaju M.K. and all other faculties, postgraduates, and my dear friends. It's with immense joy and deep respect that I welcome you all to this auspicious gathering, an occasion that brings together the knowledge, tradition, and vision. So we are profoundly honored to have with us a constellation of distinguished individuals whose presence elevates today's event. First, I am privileged to introduce Dr. Skopa Kumar, Registrar of Kerala University of Health Sciences, a guiding force in our academic community. I welcome Dr. S. Gopakumar, who has agreed to deliver the presidential address and setting the tone for what promises to be a meaningful celebration.
Thank you, sir.
It is our honor to welcome Dr. C.P. Vijayan sir, the Honorable Pro Vice Chancellor of Kerala University of Health Sciences, who will grace the occasion with inaugural address. His insights and vision continue to shape the future of health sciences education in our state. We welcome you, sir. In the spirit of celebration and encouragement, I warmly welcome Dr. Sindhu C. Ma'am, Principal of Government Ayurveda College Tripunithura, whose leadership inspires generations of Ayurvedic scholars. We welcome you, ma'am. We are equally delighted to have Dr. Noble TM, Secretary of AKGACAS, whose dedication to academic excellence and community support is deeply valued. We welcome you, sir. I welcome Dr. Shaju M.K., Head of the Department of Kaumara Pritya, who has agreed to deliver the vote of thanks. And I wholeheartedly welcome all the faculties, medical officers, postgraduates and undergraduates registered for this event. So with this, I'm concluding my welcome address because we have 3 wonderful presentations today in today's program. So let us enjoy the knowledge and enrich the field of Ayurveda. Thank you.
Thank you, sir, for that warm and thoughtful welcome that beautifully set the tone for the evening. We now invite Dr. S. Gopakumar, Registrar of Kerala University of Health Science, to deliver the presidential address. We welcome you, sir.
Thank you. Am I audible?
Yes, sir.
Most respected Honorable Pro Vice Chancellor of Kerala University of Health Sciences, Dr. C.P. Vijayan sir, respected Principal, Government Ayurveda College, Tripunithura, Dr. Sindhu teacher, Government Ayurveda College, Tripunithura is going to celebrate the 100 years. So we are very happy that Tripunithura College is also a part of this organizing team. And respected Dr. Anil Kumar sir, Professor, SFRA, Kerala University of Health Sciences, Dr. Noble, Secretary Akhila Kerala Government Ayurveda College Adhyapaka Sanghadana, Tripunithura Unit, Dr. Shaju, HOD, Kaumara Pritya, Department of Kaumara Pritya, Government Ayurveda College, Tripunithura, dear resource persons, dear teachers, dear delegates, dear students, a warm good evening to one and all. It is always great to hear that sharing of knowledge is very important component in medical education as well as in medical practice. So today we are going to have a week of webinar series that is at national level, jointly organized by Department of Kaumara Pritya, Government Ayurveda College, Tripunithura, and School of Fundamental Research Science, Kerala University of Health Sciences. We very well know the topic is very much relevant because nowadays maternal health as well as the children's health are equally affected by multiple lifestyle factors and other components. I remember when I was studying Kaumara Pritya in my BAMS, there was a very famous slogan from Ayurveda in Kaumara Pritya highlighting the importance of breast milk. Madhureva pibestanyam tadhilam deha pushtaye. The meaning is very simple. The breast milk is, the mother's milk is the most important healthy nourishing food to the child. And there is detailed description regarding the diseases connected with improper utilization of stanya, that is breast milk. And when we go through the current scenario of lifestyle, we very well know women are facing multiple challenges from different sectors. Improper lifestyle in terms of food we take, viruddhahara, the different types of food we daily take are really causing problems to the production of the breast milk and maybe leading to the contamination of breast milk. And the stress component, that is very much important. Again, I remember there is a very famous quote from our Samhita, Shukroda Lankanayasa Stanya Nashasya Hedava. See how beautifully our ancient Acharyas told how stress can influence the production of breast milk. Shukrodha Lankana Ayasa Stanya Nashasya Hedava. The shoga, the krodha, the emotional disturbances, the excessive activities, and lack of nourishment. The word Lankana may be indicating the lack of nourishment. So that means that there is enough input in Ayurveda which can be taken to the contemporary medical practice by which we can empower the maternal health as well as children's health connected with the breast milk. So I believe that this webinar will be highlighting all these topics. We are having very talented resource persons, and I understand that there are nearly 729 delegates registered for this program, and they will be joining in the next minutes. And again, I understand that delegates from 22 states across the country are here to listen this 1 week of knowledge speech. So I congratulate the organizers for having such a wonderful webinar on a relevant topic. And the most important thing is whatever we discuss here in this scientific platform, there should be enough work, enough continuation work in the field of academy and research. Some of the topics from our science regarding the prevention of diseases related with breast milk feeding and some important dietary regimen regarding the promotion of breast milk and lifestyle modification, including yoga and other therapies in breast milk. And the same way, how we can create certain medicines, how we can contribute certain nutraceuticals for the betterment of production of breast milk and having the maternal and children's health. And all these academic topics should be researched minimum at the level of PG studies. And we can even have studies at School of Fundamental Research in Ayurveda about this topic with the collaboration of Department of Prasudi Tantra and Kaumara Bhartiya of other colleges. And one more thing I want to highlight before the organizers, whatever discussions we are having here, the end product should reach the common man. We very well know that apart from the academic deliberations and the researches in the laboratory, the valuable contributions in the science of Ayurveda should go to the common people. We very well know the working women who are not aware about the maternal health. They should also feel that there are enough contributions, time-tested formulations are there in Ayurveda, which can be taken without any side effect in their maternal health as well as in the health of their children, especially connected with the reproduction as well as breastfeeding. So whatever we are discussing in this scientific platform, whatever knowledge we are gathering, the final conclusions, whatever we are making or creating, such knowledge should reach to the common man. And then naturally, the government and other policy makers will identify the potentials of Ayurveda in this particular field. So academic level, research level, and public health level, the outcome should reach. I am very confident that the organizers will be having a vision in this regard. So I congratulate the organizers once again. I congratulate all the speakers who found their valuable time to share their knowledge. And I am very much happy that this much number of delegates are there. So I wish all success to the program. Let us do more and more innovative discussions and researches in this field by which we can come with very new innovations and outcomes. And all the final conclusion should go to the public by which we can empower the science of Ayurveda as well as the care and cure for mother and children across the India. So once again, wishing all the success. I conclude my presidential address. Thank you. Thank you so much.
Thank you, Dr. Govumar sir, for your words of encouragement, guidance, and support for this timely initiative. Next, we are honored to have with us Dr. C.P. Vijayan, Honorable Pro Vice Chancellor of KUHS, who will now deliver the inaugural address and formally declare the webinar series open. Sir, we are privileged to have you.
Thank you, Dr. Amna Ghafoor, Honorable President of this inaugural session of the national webinar, Professor S. Gopakumar, the Poet Registrar of Kerala University of Health Sciences, the Chairman of the Organizing Committee, Dr. Professor Anil Kumar MV, Professor of School of Fundamental Research in Ayurveda, Dr. Sindhu, Principal, Government Ayurveda College, Tripunithura, Professors of the Departments of Prasudi Tantra, Evam Stri Roga, and Kaumari Bhartiya from various Ayurveda colleges from in Kerala and outside Kerala, postgraduate teachers, postgraduate students, practitioners of Ayurveda, and my dear students in the field of Ayurveda. I am very happy to be associated with this national webinar organized by School of Fundamental Research in Ayurveda and Government Ayurveda College, Tripunithura, because of 2-3 reasons. One being, I am also a professor of Stri Roga Evam Prasudi Tantra or obstetrics and gynecology. And another reason is that all the health professionals are getting interested in the support of breastfeeding or promoting breastfeeding. And another thing is that the students and learners in Ayurveda from nearly 22 states have already joined for this program. All these factors make all of us very happy. And this year's theme of Breastfeeding Promotion Week is to offer sustainable support for the mothers for exclusive breastfeeding. I am sure that in the coming days there will be a lot of discussions on the importance of breast milk and how the exclusive breastfeeding can be sustained and supported, and what are the contributing factors for the failure of breastfeeding. Such things will be definitely discussed in this platform, and it will be definitely useful for the learning members of the profession. But I want to stress one point, that is sustainable support for the maintenance of lactation. Recently, a research conducted by our own School of Public Health at Thiruvananthapuram found that in Kerala is having a unique position in health scenario, almost coming in the top list whenever any criteria is being considered. But even in Kerala, the breastfeeding rate or exclusive breastfeeding rate in the initial 6 months after birth is falling down below 50%. So it is an eye-opener for all of us, all the health professionals. Let it be from any stream, let it be from modern medicine, Ayurveda, homeopathy, nursing, from any stream. Yes, all of us should work together for the support of breastfeeding mothers. The society, the media, the government, everybody should come together, or their hands should get joined for this support. Then only we will be able to attain it. The knowledge about the breastfeeding and its importance, the lack of breastfeeding, what are the health problems and the benefits for the mother and the child because of continuation of exclusive breastfeeding, we all know, the scientific world know. But when it comes to the grassroots level, yes, problems are there. Government has given 6 months leave for breastfeeding mothers. So that is a very positive step. But that alone is not sufficient for maintaining exclusive breastfeeding for initial 6 months. Because today, because of the nuclear family setup, a mother who is delivering may not have witnessed somebody else breastfeeding. So each and every point is new for that mother, and it is definitely a stressful situation, as mentioned by our president during his address. So it adds on to the stress, so worries, and worries about the health of the baby, everything put together, she will find it very difficult. So sustainable support is absolutely essential. I am a person who have assisted or supervised nearly more than 1 lakh deliveries over 35 years. But I am also disappointed. I was also getting disappointed several occasions because of the failure of lactation reported before 6 months of age of the child. So that support is what is needed from the health workers. The way in which the baby is to be held, how to initiate breastfeeding, how to sustain it, how to avoid breastfeeding by laying down. So many factors are there, and we should help them. Then only the common people. Maybe the mother may be educated, even a postgraduate student or a postgraduate doctor. Yes, even if she is a postgraduate doctor, yes, it is not easy to tide over this period. So our support is absolutely essential. And I am very sure and happy that this number of students in Ayurveda, postgraduate students, practitioners, this is a very big health force, and they will support breastfeeding mothers to maintain exclusive breastfeeding during the initial 6 months period of after childbirth. With these words, I am very happy to announce that this webinar series, which is very, very important, not only today, it was important yesterday, today it is important, and tomorrow also it is important. So one of this very important topic, I'm very happy to inaugurate it and wish all success for this webinar series and also for all your endeavors in future. Thank you. Thank you all. Over to you, the Dr. Amna Ghafoor. Yes. Thank you. Thank you.
Thank you, sir, for your inspiring inaugural words, guidance, and for officially launching this important academic journey and providing a glimpse at our initiatives needed for a bright future. Now, we are immensely honored to welcome our keynote speaker for the day, Dr. Dinesh K.S., Professor and HOD, Department of Kaumara Britya, VPSV, Ayurveda College, Kottakkal, Malappuram. Dr. Dinesh is an evangelist of Ayurveda with over 2 decades of experience in clinical care, academics, and public health. A gold medalist from Calicut University, he is the founder of transformative centers like CIMCD, Ayurveda, and Aditi. His works in autism care, particularly the Agastya Protocol, has been recognized and adopted by the government of Andhra Pradesh. With more than 300 talks delivered globally, including at Stanford University and BRICS conference, Dr. Dinesh brings a uniquely integrated perspective to the field of child health. Sir, we are eager to listen to your thoughts and we welcome you, sir, for the session.
Thank you. A very good evening, one and all. Am I audible? Dr. Abna, am I audible?
Yes, sir.
Yes,
You are
sir.
audible, sir.
Most respected PVC and Registrar Gopakumar sir and Fundamental Research Institute Director Anil sir, Principal Sindhu ma'am, and all other dignitaries and my dear students. I am so happy to present the keynote address in front of you regarding the sustainable support system for the exclusive breastfeeding, especially in this platform. And I also congratulate
Dinesh, sir.
Kumar സാറേ
Sir, there is a network problem, I think. He will join soon, sir.
സാർ നമ്മൾക്ക് ഈ ആശംസ ഉണ്ടായിരുന്നല്ലോ അതങ്ങ്
Then
കഴിയാമായിരുന്നു.
we'll proceed with the felicitation, sir.
അപ്പോഴത്തേക്കും
please.
ദിനേശ് സാർ തിരിച്ചു വരുമായിരിക്കുമല്ലോ.
Amna, please.
Okay, everyone, as there is a network issue, we will now forward to the felicitation part. Now, we have our esteemed guests share their blessings and wishes. I first invite Dr. Sindhu C, Principal, Government Ayurveda College, Tripunithura, who helped us make this event possible. We welcome you, ma'am, to offer her felicitation.
Thank you. Am I audible?
കേൾക്കാം ടീച്ചറെ, കേൾക്കാം.
Okay. So, most respected KUH's Pro Vice Chancellor, Dr. C.P. Vijayan sir, respected Registrar, my dear Dr. S. Gavomar sir, Dr. Anil Kumar sir, Dr. K.S. Dinesh, Dr. Shaju M.K., Dr. Noble, all faculties and delegates, good evening. First of all, I would like to congratulate KUHS, Team SFRA, and Team Kaumaramritya of our college for organizing a webinar series on World Breastfeeding Week celebrations 2025. The importance, relevance, etc. are very well explained by our former respected speakers. And I also wish that the benefit of this webinar should reach with the public. And it was very interesting to see that a word fragmented guidance for the modern mothers in the brochure of this webinar, which is absolutely right. In olden days, previously, there was a systematic transmission of our conventional knowledge regarding breastfeeding through generations to the new mothers, which is lacking nowadays. So it is the need of the hour to make the new mothers, the modern mothers, aware about the importance of breastfeeding and about the importance of Ayurveda, antenatal and postnatal care, so that not only the baby, but the mother too get the benefit. The mother too surely get the benefits of Ayurveda. Nowadays, we can see that, as Gopakumar sir said, there are a lot of stress faced by new mothers, so that there is postpartum depression. So I think psychological involvement is also more nowadays for new mothers. So this type of webinars is surely the need of the hour, and I wish that all the sessions should be documented, and the participants of this seminar, I'm sure that they will get the benefit. They will be aware of what is told in this our science, and also what is being discussed in this webinar. But ultimately, our new mothers and the public should get the benefit of Ayurveda and the webinar. So once again, I congratulate Team SFRA, Team Kaumaramritya and KUHS. And also I wish all the best for the success of this webinar series. Thank you all.
Thank you, ma'am, for your encouraging words and support. Now I invite Dr. Dinesh sir for delivering the keynote address. We welcome you, sir.
Sorry for trouble. There was some technical issue. While I'm audible now, no? Hello? Am I audible?
കേൾക്കാം സർ, കേൾക്കാം.
Yes. World Breastfeeding Week, the sustainability is a big question nowadays. That is the reason why, because this topic is being forwarded, because we all have some stereotypic belief and emotional attachment towards the breastfeeding concept. No doubt. All science, all humanity, all anthropologists, all the social scientists, everyone are keen to observe upon this emotional activity as well as the scientific activity that breastfeeding, and all we know the breastfeeding is that much important, but it is much more than the real importance what we are considering regarding the breastfeeding and its impacts. And that is because there are a lot of challenges are happening for the sustainability of the breastfeeding techniques. And the cohorts actually put forward at how the support system has to be integrated with Ayurvedic epistemology. And, breastfeeding, no doubt, it's a foundation of child health. But, exclusive breastfeeding has become a global campaign. And whether we are giving the very same importance to the very same important other parameters of the child health or not. This is being discussed in several recent publications, especially the Lancet-like journals are discussing why this breastfeeding is given this much prime importance. Of course, it is important, but when we compare with other health challenges and health benefits, why we are not giving the very same equal importance to other factors which are related to child health? I am not talking about the vaccinations, I am not talking about other feeding techniques, but generally, especially when we compare with the campaigning of the UNICEF, like first 1,000 days of life, beginning from the conception up to the 2 years of life of a child, there are lot many factors which are governing directly to the child health, as equally important as our breast milk and breastfeeding. But many of those factors are getting ignored, and the breastfeeding, obviously, it is getting super highlighted. And this analysis is the time, or this is the right time to discuss. And there comes the importance of the holistic nature of Ayurveda epistemology for sustainable support system for these breastfeeding techniques. And all we know, the first 1,000 days are very important and crucial for the life of a child, beginning from the conception. So a sustainable breastfeeding techniques, inevitably it must include the antenatal care of the pregnant woman. The antenatal care of the pregnant woman, both physically, mentally, socially, and in every aspects. And this exclusive breastfeeding up to 6 months, why promote only exclusive breastfeeding? According to the recent studies, 4.9 courses of antibiotics per child administration is happening in India within the first year of life. 4.9 course of antibiotics. The most prevalent city is Vellore. The very same importance of the breastfeeding, exclusive breastfeeding up to 6 months, has to be given to this catastrophe also, because nowadays the breastfeeding is getting a lot of anti-propaganda, as well as breastfeeding is getting challenged by different health conditions of the child by this antibiotic administration in an amount of 4.9 courses of antibiotics per child per year in the first year of life. Such several studies are out nowadays. use of antibiotics in children younger than 2 years in 8 countries. This is a prospective cohort study. And whenever we are thinking about the exclusive breastfeeding, this very same slogan is double-edged sword, because most of the propagations of the exclusive breastfeeding and breastfeeding up to 6 months is driven by industrial people, not by the NGOs like, or not by the WHO, not by the UNICEF. The most cited, reputed, the campaigning are from the industrial people. This is firstly noted by several discussions in the Lancet journal. That is the reason why, because whenever they are thinking about the alternatives of the breast milk, because it is a very big question nowadays due to several problems of the intestine of the child, the gut immaturity of the child, and the polluted breast milk cases are alarmingly increasing. So there are several discussions about the alternatives also. So this breastfeeding campaigning week equally discuss the eco-friendly green feeding, infant nutrition. This is quite important, because whenever there is a change occurs, whenever there is a problem occurs to this exclusive breastfeeding, there comes the alternative feeding techniques, which are mostly carbon food not at all. There comes the importance of this green feeding, eco-friendly infant nutrition for the sustainable choices, number one. Then environmental impact studies are coming up regarding the artificial feeding techniques. Reduced dependency. It actively helps reduce the reliance on energy intensive ultra processed formula products and their associated waste. Dual benefits. This practice supports both optimal environmental health and superior infant well-being simultaneously. Without discussing this area, we cannot go beyond, or we cannot go along with this exclusive breastfeeding up to 6 months of time. This is the classic executive summary. For decades, the commercial milk formula industry has used underhand marketing strategies designed to prey on parents' fears and concerns to turn the feeding of infants and young children into a multi-billion-dollar business. Even the real breast milk is now turned to a multi-million business commodity nowadays, because all we know, as Ayurveda said, breast milk is the only alternative. Human breast milk is the only alternative for, which is the right alternative for the real breast milk. So this is coming up, scaling up. This industry is scaling up nowadays without considering the carbon footprinting. That is what I told you. So breastfeeding trends and the challenges globally, according to different statistics, PVCs are already told that in Kerala, the exclusive breastfeeding techniques are coming down and the trend is coming down. And globally, especially the low middle income group countries, 37% of the infants under 6 months of low and middle income country groups are exclusively breastfed, indicating a significant gaps. India leads with over 90 human milk banks, and they are flourishing like anything in India. Especially the donor aspects is alarmingly increasing with a lot of other social anxieties. So barriers to breastfeeding are shaped by different socio-cultural contexts nowadays. And there are several studies that come from third world countries. What are the different barriers? Especially even in developed countries, All we know, we all have this maternity leave up to 6 months in our public sector workplaces, but that's not the case in majority of the area. They need to resume the job at the earlier stage. So this work-life balance, either to the paddy field or to the IT company, whatever it may be. In case of third world countries, they need to resume their paddy field job. In case of IT field also, they need to resume the IT job. So in both economical edges, work-life balance is not happening, and this is the first hindrance towards this problem of this exclusive breastfeeding. And nowadays, especially in Kerala, near about 38% of the birth is medicalized. 38% of the birth is highly medicalized. So highly medicalized childbirth practice can sometimes interfere with early initiation of breastfeeding and formula marketing. Their marketing technology is highly aggressive, so that a less educated parental community will be highly influenced by ethical. Even the ethical marketing is highly double-edged sword, and it is causing a lot of entry of formula products instead of the real breast milk feeding. Then challenges in underdeveloped nations, especially the traditional practices. There are a lot of traditional practices which are hampering the exclusive breastfeeding techniques. That is not the traditional practices which are mentioned and practiced nowadays in Ayurveda like prasha, but there are several other practices like the early intervention of black tea, early introduction of several other food alternatives. Then maternal health, high rates of maternal malnutrition. The country like India is facing a lot of issues with the quality of breast milk. And economic pressures, mothers are often forced to return to the labor early. And misconceptions like persistent belief about milk insufficiency. This is very dangerous nowadays. If the child is having incessant cry, the mother herself is deciding that it is due to the lack of breast milk quantity. And immediately they are introducing the new formula milks, and the child will stop its crying, so that the mother will exclusively decide that it is due to the lack of breast milk. So this misconception is highly alarming nowadays. So health interference in infants, as I told you, if you are comparing the exclusive breast milk, or is there any lack of exclusive breast milk feeding with a comparison other group of this indiscriminate use of antibiotics, which one will be given more priority, and the importance is a highly questionable thing. When we look into the different literatures, early developing microbial environment system of the intestinal or the intestine of this young child will be totally disturbed by this indiscriminate use of antibiotics. That also has to be taken into consideration. And Ayurveda have some unique approaches towards this infant welfare. Ayurveda promotes the holistic approach to the child welfare, and they are extending, Ayurveda is extending beyond exclusive breastfeeding. It fully supports exclusive breastfeeding, no doubt. It fully supports exclusive breastfeeding, but at the same time, the very same priority is given to several other factors, like how the environment is, how the physical and mental and spiritual well-being of the child as well as mother is, how much quality is there with the milk. And modern science is giving least priority to that, and this is a lacuna also. How much quality is? Whenever we are treating the cases of lactose intolerance, all we know lactose intolerance is a problem of gut and lactose mismatch through genetic principles according to the modern epistemological understanding nowadays. But whenever we are treating the pitta dushta stanya, and we are giving the treatment to the mother, and the child is getting okay with the very same breast milk. So my point is, the existing theories has to be again rediscussed for such understanding. So unique contributions of Kerala Ayurveda pediatric healthcare, this article will give you very nice introduction regarding these other parameters which are to be given the very same consideration of the exclusive breastfeeding up to 6 months of age. So quality of the breast milk. Ayurveda believe that majority of the breast milk has to be examined if the child and mother is producing the clinical features. If the child is suffering from a respiratory tract infection, rather than going to treat the respiratory tract infection, check the breast milk for its purity in terms of Ayurvedic epistemology. If the breast milk is affected with kaphadushti, treat the mother for the breast milk, pure breast milk, so that the child will get rid of this recurrent upper respiratory tract infection. Such a concept has to be integrated. And regarding the quantity, sufficient quantity, how much quantity of the breast milk is there, that has to be assessed. And there are a lot of Ayurveda supplements, Ayurveda medicines. By looking into the individualized character of the mother, we can have plenty of options of galactogogues. And nurturing the environment, provide a safe, stimulating and loving environment for a healthy development of the baby and maternal well-being. As our registrar sir told, Shukroda Langhanaya Sastanyanaša se Hedava. Similarly, the Viruddhahara Bhuktaya Chudidaya Vichetasaha. Vichetas. So such maternal well-being is very important for the health of the baby and the quality of the breast milk. And gut health, promote proper infant gut health, not only by giving the breast milk. And Ayurveda advocates a lot of other supplements in a very low level dose other than the breast milk, even though the modern epistemology stands against this administration of different type of other prashas, but it is highly contributory to the gut health of the infant. And in temperate climate like India, especially, we need to promote that administration of not the food, but the prasha like administration of certain drugs and other food like materials for giving optimal immunity. And several such studies, we have published several such studies that if we are giving such prashas in the form of the churnas, we can build a lot of good microbial environment in the form of different observed taxonomical units of different types of bacteria, which are highly creating good ecosystem of the intestinal microbial colonies. Such studies are came out. So try to promote such prasha techniques to give maximum beneficial gut environment, so that almost all the gut problems can be solved by this administration. So such Ayurveda practices can be abbreviated like this, like Uramarunu, Suvarna Prasham, Navajada Abhyangam, and a medicinal bath. Medicinal bath at the earliest to the infant, and Pragara yogas, and first medicine from Ayurveda for minor illness syndrome. We know there are 62 million office visits for acute respiratory tract infections for the symptoms of the children are getting lost globally in a given day. So the minor illness syndrome is, it may be a common flu, or it may be an upper respiratory tract infection, or it may be an infantile colic, or it may be a peptic problems, acid peptic problems, whatever it may be. And in highly medicinalized society, these minor illness problems are getting more attention for higher medications. So first medicine from Ayurveda can be a slogan for minor illness syndrome. So these are my humble suggestions in my keynote address towards this good cause. By this, I am winding up my keynote, and namaste to and thank you for all the patient listeners, and thank you for the university as well as for the Fundamental Research Institute and the Department of Kaumarabhartiya of Government Ayurveda College, Tripunithara, for this wonderful opportunity. By this, I am winding up. Thank you very much.
Thank you, Dr. Dinesh sir, for the enlightening keynotes which help us to emphasize on maternal and childcare. Please unmute yourself.
Okay.
Sorry for the interruption. Once again, thank you, Dr. Dinesh sir, for the enlightening keynote which help us to emphasize on maternal and childcare and truly bridging ancient wisdom with modern maternal care challenges. Thank you, sir. Now, I welcome Dr. Noble TM, Secretary, AKGA-CAS, to felicitate the gathering.
Hello, am I audible?
Yes, sir.
Yes.
Yes, sir.
Most respected Dr. C.P. Vijayan sir, Honorable Pro Vice Chancellor, respected Registrar Dr. S. Gogomar sir, Dr. Dinesh sir, Dr. Sindhusi madam, Director Dr. Anil sir, Dr. Shaju MK, and all the dignitaries present. It is indeed an achievement for both Kerala University of Health Sciences and SFRA for holding a webinar on a topic which is very important in human life. Hopefully, as the primary goal of the national webinar is highlighting awareness on Ayurveda's role in nurturing lactating mothers through dietary support. Of course, Ayurveda offers a lot. Surely, this venture will help the participants in their practice. On behalf of AKGACS, myself, Dr. Noble TM, expresses all the best wishes for the webinar and admires the effort taken by the university and SFRA towards the noble cause. Thank you. Thank you all.
Thank you, sir, for your gracious wishes and continued support. Now, to express our heartfelt gratitude to all who made this day possible, I now invite Dr. Shaju MK, Head of Department, Kaumari Bhritya Department, Government Ayurveda College, Tripunithara, and the convener of this event to deliver the vote of thanks.
Namaste and good evening to all. On behalf of the organizing committee, I extend my heartfelt gratitude to everyone for being a part of our seminar. First of all, foremost, I thank our esteemed dignitaries, Dr. Anil Kumar MV, Professor SFRA, for the warm welcome address. And thank you, Dr. Gogumar sir, Registrar Kuhas, for the presidential address. And thank you, Dr. C.P. Vijayan sir, Honorable Pro Vice Chancellor Kuhas, for the inaugural message. Thank you, Dr. Dinesh K.S., Professor and HOD, Department of Kaumarabhartiya, PPSV Ayurveda College, Portugal, for the enlightening keynote address. Once again, I extend my sincere thanks to Dr. Sindhu C., Principal Government Ayurveda College, Tripunithara, Dr. Noble TM, Secretary, AKGCAS, for their gracious presence and words during the felicitation. We deeply appreciate today's eminent speakers for their insightful scientific sessions. Dr. Rina Kulkarni for her thought-provoking talk on breastfeeding beyond nutrition. Last but certainly not least, our heartfelt Thanks to all the participants from across the country for our enthusiastic presence and active engagement. Your participation truly energizes this academic endeavor. We look forward to your contribution presence in the coming session. Thank you and have a wonderful evening.
Thank you, sir, for your expression of gratitude. Once again, thank you all for being a part of our inauguration ceremony. Next, our first session is Breastfeeding Beyond Nutrition in Infant Health and Disease by Dr. Reena Kulkarni, Professor and Head of Department of Kaumara Britya, SDM College of Ayurveda and Hospital, Bangalore. Dr. Reena is a nationally renowned academician and clinician with over 14 years of experience in Ayurvedic pediatrics. A pioneer in the pediatric Panchakarma and neurodevelopment Ayurveda, she has guided postgraduate scholars and published 45 plus research articles. She is the recipient of the prestigious Kumara Ratna Award and has been a resource person in over 50 national and international seminars. Her work spans developmental disorders, breastfeeding support, and integrative child nutrition, making her one of the most influential voices in Ayurvedic child health today. Ma'am, we warmly welcome you to share your expertise.
Thank you, ma'am. Hope I am audible.
Yes, ma'am.
At the outset, I would like to congratulate the organizing team for the wonderful organization of this program and the presence of over 700 participants on this platform says that how well organized, how well planned is this program. For this, I would like to first take the names of all the dignitaries who are present for this program, especially Dr. Anil Kumar MV sir from the Research Institute, Dr. Shaju MK, the head of the department, Ayurveda College, Tripunithura, as well as the backbone behind this program, respected Bindu ma'am. So thank you for inviting me for this program and giving me an opportunity to share some of my views. Thank you so much, and I wish all of you all the success for the coming series of talks in this particular webinar. And for the moment, I would like to share the PPT. I hope it is visible.
Yes, ma'am.
See, we had a very nice talk from all of our favorite teacher, Dr. Dinesh sir, regarding the breastfeeding and its importance and what Ayurveda offers and what best we can inculcate the traditional practices. So thank you, Dinesh sir, for those inspiring and enlightening words. Now my job is regarding breastfeeding beyond nutrition in infant health and disease. Throughout this presentation, I would like to update the current concepts with that of the Ayurveda and wherever necessary, what are the current researches going on around the world regarding the breastfeeding and what updations we have to make regarding this field. So this will be my presentation for the day. Now, World Health Day is celebrated on April 7th. And for this year, the slogan has been Healthy Beginning and Hopeful Future. A year-long campaign on maternal and newborn health is planned on this, and it is being worked on by all the health services around the world, across the world. And there is an urge on governments and the health community to ramp up the efforts. And what else can be the best beginning other than breastfeeding? for healthy beginning, as we all know that breastfeeding is the foundation of life. So with this word, I would like to say that World Health Organization has given a lot of emphasis on maternal and child care, especially newborn health in this particular year. Now coming to why breastfeeding week. See, Frank Oski once imagined that world had created a dream project to feed and immunize everyone born on this earth. Also imagine that it was available everywhere, required no storage or delivery. It helped mothers to plan their families and also reduce the risk of cancer. So such a wonderful gift which the nature had given. Then imagine that a day came when the world refused to use it. I hope you are understanding. I'm speaking about the breastfeeding. Nature has given this a perfect food and immunization for the mankind, and in the days human refused to use it. As a result of this, World Breastfeeding Week started to mark that important of this nature's gift. It started way back in 1992 after 1990 Innocenti Declaration. And in 2016, it was aligned with the Sustainable Developmental Goals. And for our interest, you see exclusive breastfeeding is moved from 38% in 2012 to 50% in 2025. Still, it is not so much encouraging, isn't it? Because once upon a time, it was the 100% food which was available for babies, and it was the complete food. And now where do we stand? 50%. This makes why the breastfeeding has to be prioritized. Now, this picture itself says that breastfeeding is the birth rate for every mammal, and it is the what we say perfect nutrition. Now see some more the statistics. Current Global Breastfeeding Scorecard 2023 says that upon the target, where do we stand? We are well behind the target we have set. And interestingly, in a country like India, you see the rate of breastfeeding. NFHS 5 data says that there is only 41.8% of institutionalized deliveries are being initiated with the breastfeeding in the first 1 hour of life. Pathetic, but we can still improve, right? And this is the goal of Indian Association was to reach the target of 55%, and current rate is only 50%. What are the recommendations available? We know that early initiation of breastfeeding at birth, less than 1 hour of delivery, and exclusive breastfeeding till the age of 6 months, complementary feeds to be introduced at 6 months, continue breastfeed at least till the age of 2 years or more. So it is aligning with what Ayurveda also propagated from the ages behind. That is, the breastfeeding to be started immediately in the course of Jatamatra Paricharya itself. And Shashtyanna Prashanam, 6 months start with the complementary feeding. Bhaje yata yata channam stanyam tajam tata tata. Continue the breastfeeding as long as you are introducing the food. And it has to be continued even in the Kshirannada Kala, Samvatsara Paraha, Kshirannada. So breastfeeding is the mother's gift to herself, her baby, as well as the earth. So this has to be, see, we have to re-emphasize on the utility of this. This is our situation for the day. Now when to start the breastfeeding? As soon as possible, which is called as the golden hour of birth. Right? As I said previously, only 41% of our kids are getting breastfeeding in the first hour of delivery, as against almost 90% of the institutional births. Why to breastfeed? Why the breast milk? The whole, as we have already know, I just take a few minutes for these basic slides. It is considered as the wholesome food, which is sterile and non-contaminated, readily available, and is highly specific for the child. And it is a gold standard nutrition for infants, which has all the perfect ingredients and naturally available, tailor-made for the gestation age of the child. So it imparts Madhureva Pibetstanam. The importance is already emphasized by Gopakumar sir as well as Dinesh sir. Right? Along with that, it is Dhatuvardhana, it is Ojasya, Vrishya, Sleshmala, and it imparts the health. So now coming to Stanyaguna, see, it says that it is, see, just the highlighted marks are regarding the nutritional benefits of this. What is the interest of today's talk is about Dhatuvardhana, how it acts as nourishing and promoting for body tissues. Arogyakaram, how it is health promoting, Aujasyam and Satmyam. And it is also excellent remedy considered in the case of Raktapitta for Navana and Tarpana in case of Akshiroga as well as in Abhigataja Akshirogas. Now coming to the composition, the breast milk has a beautiful dynamic composition. It varies according to the age of the baby from the beginning to the end of the feeding and may be different at different times of the day also. As we know that colostrum secreted between 0 to 3 days, which is highly rich in proteins and protective factors. Transitional milk 4 to 14 days, which is rich in fat and sugar content, and mature milk, which is called as after 14 days, which is a perfect nutrition for the child. Now coming to colostrum, which is Sadhya Prasutayaha Yahastanyam Piyusham Uchyate. Prasuti dinad arabhya yavan malinam ganam kshiram tavat piyusha. How long? Up to 7 days it is considered as piyusha. And it is necessary for the baby as it is also considered as first immunization for the baby as it gives a lot of passive immunizing factors to the baby. Right, it is thick, sticky, bright lemon and yellowish fluid. It contains the vitamins, fat-soluble vitamins like A, D, E, K also, which are very essential for the baby. Right, it is also rich in vitamin A, IgA, which is a gut-lined mucosal protective factor. It also contains a lot of epidermal growth factors also that aid in gut ripening. I mean to say that they are going to prevent the infectious invading agent through the gut. So this is regarding the benefits derived through the liquid gold called as colostrum. Coming to the properties of breast milk, I'm not going to deal in very detail about this. This chart gives you a good idea regarding how perfect is the breast milk for the baby. Few things very important to know this. It contains the sugar in the form of galactose, which is the brain growth promoting, sweetest of all the sugars available. Right, then perfect calcium phosphorus ratio for bone growth promotion. Whey protein, which is easily digestible and less allergenic to the baby. As I discussed, it is a good source of vitamins and protective factors. It is also rich in sulfur-containing amino acids, which aid in brain development. Brain lipids that contain PUFA, which is again helpful in differentiation and arborization of the neural tissue. It has arachidonic acids and DHA that are important again in neural as well as visual development. Other growth factors like thyroid stimulating hormones, thyroxine, growth hormone releasing hormone, insulin, somatostatin, epidermal, all of them help in the tissue development of the child. The immune factors like lysozymes, macrophages, immunoglobulins like IgG, IgM, IgA, complement factors, and accused phase reactants also provide a good protection against various diseases in the newborn. So lactoferrin, which is a bacteriostatic, which inhibits the E. coli proliferation. Bifidus factor and the acidic pH of the breast milk leads to the colonization of the Lactobacillus bifidus in the gut. So this is what the Dinesh sir was emphasizing regarding the gut bacteria. Now coming to the digestive enzymes, it is rich in lipase and amylase. It also has a para-aminobenzoic acid, which acts as a malaria prevention factor. More so, it is ready, economical, convenient, and having the right temperature to be administered. No need of efforts to prepare it. And it's less hazardous. So this is how it's a diagrammatic representation, a very beautiful representation of the composition of the breast milk. Now, as I said, the composition can vary in different stages of feeding itself. Foremilk is rich in water, which quenches the thirst, provides plenty of protein, lactose, and other nutrients, while the hind milk is more thicker and provides much energy and satiety. So, nature knows that when you initiate feeding, first thing is you calm the baby and you quench the thirst. Then slowly you fill the tummy and give the nutrition. So the preterm milk, you see, preterm has different needs. It needs a lot of factors for brain development. So it needs for angiogenesis, maturation of various cells and organelles, as well as erythropoiesis needs to be started. And you see perfectly the preterm milk is tailored for it. These are the benefits of breastfeeding. So apart from whatever we discussed, so it increases the IQ for the infant. It prevents diseases like necrotizing enterocolitis, SIDS, that is sudden infant death syndromes, better immunity, better nutrition, and it prevents, adult onset diseases, diabetes mellitus, heart disease, carcinoma, and hypertension. Right, so sir was discussing regarding the first 1,000 days of life. You have the best protective cover, which we are not utilizing, that is nothing but the breast milk. Then coming to mothers, it reduces PPH. It has a natural spacing effect, reduces the risk of breast and ovarian cancer. It's readily available, ready to serve, tailor-made nutrients. And coming to society, low cost, healthy generation, less environmental pollution, less investment on disease burden, and better family bonding. What else we require? Only thing we have to address certain deficiencies like, the vitamins, and which have to be supplemented after certain age when the child grows. Now, breastfeeding is not contraindicated in most of the conditions. See, with regards to the childhood illness, general illnesses are not at all a contraindications. The mother can still continue the feeding in the general illness of the child. Why it is so important? The child is already having reduced appetite. It is reluctant to feed. And only thing it's delicious is the mother's milk. The mother's milk, it can give a immune support as well as maintain the nutrition of the child, and it can prevent the weight loss if a planned 1 or 2 additional feeds are given to the child. So this is regarding the breastfeeding in childhood illnesses. Contraindications of breast milk, there are a certain mention in the classics, but they are very general, like Viruddhahara Bhuktayam, Shudhitayam Vichetas. Pradushtadatho Garpinya Stanyam Rogakaram Shishu. The possibility of certain diseases can be contracted through the breastfeeding. But however, the general contraindications can be very well managed by taking certain precautions, hand hygiene, covering the respiratory tracts, right? And the handling the baby. So many of the disease transmissions can be prevented, which are of infectious nature. However, there are certain diseases with lesser percentage which are transmitted through the breast milk. We'll take it up little later. So they are considered Sambhavanti Maharoga Shuddha Kshira Sevan. And sometimes vitiated breast milk can cause diseases like, Pranavastrotas or Mahastrotas. And we have a different plan of management for these things being advocated in our classics. However, there are certain conditions where the breast milk is absolutely contraindicated. Conditions like, galactosemia, the phenylketonuria, the inborn errors of metabolism in the babies, and in case of if the mother is using substances like opioids, cocaine, so in such conditions it has to be completely avoided. Certain medications like antithyroid medications, radioiodine therapy, and anti-concept drugs, babies need not to be fed with the breast milk, because there is a risk of the effect of these cytotoxic drugs. Then in countries, developed countries like US, there is absolute contraindication of breastfeeding in HIV infected mothers, untreated brucellosis, and suspected cases of Ebola virus. However, in India, HIV, HPSAG are not contraindications for breastfeeding, outweighing the benefits and risk of transmission of the disease. So also in many of the developing countries. So breastfeeding is also associated with a long-term well-being, including low risk of diseases like especially non-communicable diseases like asthma, cancer, and autoimmune diseases, childhood obesity. It also has components like non-immune and immune cells and bioactive molecules like cytokines, chemokines, lipids, hormones, and enzymes, which reportedly play many vital role in the breastfed newborns against the disease protection, and they also shape the immune system of the newborn. Now, looking into certain statistics, the relative risk of deaths from the acute respiratory infections by the age and breastfeeding category in Latin America, you can really see that as much as many percentage of diseases can be prevented just by breastfeeding. For first 3 months, it could be as less as 1%. However, if you continue to feed up to 1 year, it can be as less as 0%. So also the diarrheal deaths can be minimized in case of children just by continued breastfeeding. Coming to the risk of diarrhea by feeding methods in infancy. Breastfeeding only 1%. Breastfeeding along with the non-nutritious liquids, you see, it is triple of this. So breast milk with the nutritious supplements, you can see it is as much as 10 times more, 10 to 12 times more. No breast milk means worse. So coming to breast milk as a source of prebiotic human milk oligosaccharides and bacteria from the lactobacilli family. So most of them act as a good source of good bacteria which aid in the gut priming and prevents a lot of adverse reactions through the gut. Now coming to the percentage of neonatal deaths, you see if you within 1 hour of initiation of breastfeeding, if the baby is initiated with a breastfeeding within 1 hour of delivery, so it can save as much as 22% of neonatal deaths. And if it is within 24 hours, it can save 16% deaths. Now coming to the relative mortality risk in the absence of breastfeeding, you see, less than 2 months, highest rate of mortality. And as long as the baby is around 1 year, if you continue to feed up to 1 year, it can be reduced. Now coming to under 5 child death percentage, so you can see breastfeeding alone can prevent almost 13% of death of the under 5 kids. What else we are looking for? Why? It doesn't mean that we should not search for new things and newer modalities of treatment. But neglecting the available such a good source is what is pathetic for all of us. Now coming to breastfeeding and the infant mortality, relative mortality as per the disease. You see, the breastfeeding almost can reduce the 40% of sudden infant deaths. Of course, it is not so prevalent in India. However, it is one of the cause for 40% of mortality in the Western countries. Recurrent lower respiratory tract infections can be prevented as much as 19% by just breastfeeding the baby exclusively for 6 months. So also with the 43% of otitis media and asthma up to 10%, and just breastfeeding up to 2 to 4 months can reduce 26% prevalence of eczema. Now breastfeeding for 6 months can have lower risk of non-communicable diseases. Now it is very child died out of heart attack. High school child sudden death because of heart attack. You see, it can prevent 18% of childhood obesity. Then the type 1 diabetes by 57%, 33% of type 2 diabetes and leukemia can be prevented by 19%. Now coming to the newest research regarding to breast milk, that is human milk oligosaccharides, which are complex sugars present in breast milk, third largest of the solid component, and they have no nutritive function. So what are the functions of this human milk oligosaccharides? They aid in memory, they aid in language acquisition, learning skills, attention, gut bacterial growth, gut barrier function, reduction of visceral pain, regulation of the gut contractility, decreasing the infections. They can also effectively inhibit pathogens like, Pseudomonas, Escherichia coli, Campylobacter jejuni. See, most of the causes for death secondary to diarrhea, right? Secondary to infectious conditions can be prevented. Who is aiding for all this? Certain components which are present in the breast milk itself. Now coming to the importance of breast milk in IQ. Breastfed children have an IQ which is approximately 5 points higher than the children who are not breastfed. You can go through the research papers cited here. So maybe this is the reason throughout the world, Indian are considered as one of the very intelligent community, because most of these years, Indians had no option than the breastfeed. Now coming to the bioactive extracellular vesicles. This again a new research. It says that these are all membrane-bound particles which are rich in proteins, lipids, and nucleic acids, including messenger RNA and microRNAs. They play a pivotal role in immune modulation and intracellular communications. They also modulate the gene expression in the target cells. Now, what are the researches been done? Preclinical studies demonstrating these effects. So, on the necrotizing enterocolitis, allergies, HIV, neonatal infections. Now, cost. Nation economy, breastfeeding can annually reduce a minimum of this much of respiratory burden. So, and the episodes of diarrhea and obesity can be prevented by 26%. Diabetes type 2 by 35%. Overall, 4,300 crores of annual investment can be prevented by reducing the disease burden. And it also aids in the improved IQ. Improved IQ further aids in the increased growth of the economy. So these are all the benefits which tell us that why to prioritize the breastfeeding. And how to prioritize? First of all, this information has to be transmitted to the target users, that is the common people. So the healthcare workers have to inform this. They have to take a continuous anchoring role in disseminating this knowledge and engage in encouraging the people regarding the breastfeeding. And we have to, this action has to be connecting to the support systems, including the family, including the policymakers, and also including the peer group. Now, how to do this? How to galvanize this importance on the breastfeeding? So it starts with the antenatal preparation itself. So every pregnant woman has to undergo counseling regarding the benefits of breastfeeding. Counsel the young women or those having the first baby. It's very important. Lot of problems during the new mothers feeding the baby. Counsel all the women at least twice during the antenatal visit. And remember, antenatal breast preparation is not necessary. As we all know, the stimulation around the nipple can stimulate the oxytocin reflex. So don't need to stimulate the breast tissue. No need to stimulate the nipple. Only knowledge about the breastfeeding importance is what is essential during the antenatal care visits. Now at birth, every hospital, every doctor, every caretaker has to enthusiastically support the breastfeeding and recommend the human milk for certain infant illnesses also. So it is for, there could be a red dye, which can be very well managed by installation of the few drops of breast milk. That has to be inculcated. We have forgotten this knowledge. So that has to be reinforced and initiate this direct skin to skin care so that there is an effective bonding and effective secretion of the breast milk, which initiate the breastfeeding in the first hour of the birth in all healthy infants. Help the mother for positioning and attaching so that it reduces the pain during the breastfeeding and makes it a pleasurable experience for the new mothers especially. So also in the postnatal care, we have to keep on supporting the breastfeeding and recommending breast milk so that if you keep on emphasizing it, it makes that people think that it is of so much important. And it is so. And assessing the feeding pattern, correcting their position, sucking behavior observation, breastfulness and its management, all these will support the mother and encourage the breastfeeding. Try to implement the baby-friendly hospital initiatives and avoid commercial formula packs. So most of the institutionalized deliveries, because we cannot monitor, we cannot be along the side of the mother, use the formula feeds. And these formula packs are given, discharged along with the mother and baby, and that continues to be fed because of the lack of the information. So even in NICU, one can initiate the expressed breast milk immediately so that further counseling and assistance can improve the rates of breastfeeding. So in difficult situations like feeding, always remember that bedding in, rooming in, and the affectionate care by the caretaker as well as the doctor can improve the rates of breastfeeding. So very important, latching positioning is very important. Otherwise, it will be a painful experience, and especially new mothers refuse to feed the baby for this. And not enough milk is a situation mostly because of the lack of this positioning and knowledge. And this can be prevented by such a simple efforts. And it also go a long way in building confidence and giving support to the mother. Now, expressed milk. See, we all know that in recent years, all ladies are working women and they cannot continue the breastfeeding for so many other reasons, hurdles which they have. But still, we can train them very well for expressing the milk and educate the mothers regarding the role of fore. What is role of fore? So, expressed milk can be stored effectively for 4 hours in the room temperature and for 4 days in the refrigerator and in the freezer for 4 months. And we have to educate them thawing, that is making the breast milk to be normal at temperature, room temperature, before it has to be fed to the baby. And baby care facility should be made as a strict rule for the what we say for the appointment, so that they can have the facility in the working place itself. And feeding breaks, like you have short break, long break, right? Snacks break, like that. Feeding breaks should also be encouraged for the working mothers. Creating the sustainable support system, this cannot happen with the one person's effort. So it is it is a collective responsibility, right? So government, we all know that sir was mentioning this, government is already supporting with a 6 months maternity leave, irrespective of government or private sector. However, there are childcare leaves in case of central government, which is almost up to 1 year. And there should be enough provisions for feeding in the workplace. And the hazards of artificial feeding has to be educated to the mother as well as to the immediate community. So this makes, like, these all our efforts when put together can make the breastfeeding a priority issue, and it can support the breastfeeding and for the healthier planet. To conclude, celebration of breastfeeding week should not be restricted for this first 7 days of August. It should be done like a campaign. It should be non-stop efforts. Then only we can achieve the goal of healthy beginning and hopeful futures. So along with this, I would like to once again congratulate the organizing team as well as all the participants for this patient listening. Hope these informations would be of interest for you and you would all support the breastfeeding. Thank you all. And if at all any few questions regarding this, we can take up quickly. Thank you.
Thank you so much, Dr. Reena, for bringing a multidimensional perspective to the role of breastfeeding in preventive and curative child health. The call is now open for discussion. We welcome everyone to please unmute and share your response or share in the chat box. Thank you, Reena ma'am, for the session. Can we move on to the next session?
Thank you so much.
We now invite Dr. Shaju M.K. sir, Associate Professor and Head, Department of Kaumara Britya, Government Ayurveda College, Tripunithura, and Coordinator for our seminar to deliver a session on quality analysis and management of Stanya Dushti in Ayurveda. With his rich clinical experience and research contribution, we are sure to gain valuable insights. Sir, please join.
Oh, good evening. Good evening. Please, Good evening. Good evening, all. I am myself, Dr. Shaju. And my topic is the quality analysis and management of Stanyadushti in Ayurveda. So Stanya is, first we have to know what is Stanya in according to Ayurveda concept. So Stanya is the Rasaprasadaha Madhuro Pakvahara Nimittajaha Krishna Stano Praptaha Stanyamitya Bidhiyade. That is from the Sushruta Samhita Nidhanasthana. That is the essence of rasadhatu produced by the digested food normally, that is sweet, and comes to the breast from the entire body, that is known as Tanya. So we can have the holistic approach. So in Kashyapa Samhita, we have had a great thought from the Kashyapa Acharya. So Yadandamanam Prayana Garbhini Stri Nishevade Raso Nivartate Tadrak Krida Chasya Pravartate Madra Pushtyartham Megamcho Didiyo Garbha Pushtaye Tridiyo Stana Pushtyartham Narya Garbhastu Pushyadi. So, ahara consumed by the Garbhini, that is pregnant woman, has three functions. One is Madhra Pushti, and that is for the nourishment of the mother. Next is Garbha Pushti, nourishment of the fetus. And next is the Stana Pushti, that is mammogenesis. So, according to Harida Samhita, so we have the formation, how the milk is formed in the breast milk as such. We can have Yadahara Jadantu Rasam Shira Anugam. Raso Jalam cha Bhuktam Tadha Pitena Samyudam Pajidam Jadre Vahno Pitena Sahamurchidam Pachamanam Chira Praptam Kiratoyena Putragaha Tena Chiram Dikshadam Agni Somatmagam Payaha Amradam Sarvabhudanam Jivanam Balagurpatham. So we can have the elaborations. Yed Ahara Jadam Tu Rasaha, that is the Ahara Jada Rasa of the mother. Raso Jalam cha Bhuktam consists of Ahara, Rasa, and Jala after Pajana. Pajidam Jadrevano, Pitena, Sahamurchidam. Transformation of Rasa is made by Jadrakni and Pitta. Then Sira Praptam, getting Sthana Samstrayana Uras and Shiras of Sthana. Then contribution of Thoshas, the formation of Stanya. Shira Midikshadam Agni Somatmagam Paya. Such a beautiful reference that is having the Som, Agni and Soma, both are the Panchabhutiya constituents in the formation of the milk. That is dual, it's having the dual quality. That is Paitiga due to the formation of Rasa by Pachana, Kabaja due to the Sthana Samshraya in Ura, and Vadiga due to the Niyamana, that is the controlling factor. That is the both the Pitta and Kabha, both are controlled by Vada, that is the Niyamana is the function, and that's why the milk is formed. and Sani Sambatu, Prakriti Varna Gandharasa Sparsham, Udapatrecha Duhyamanam Budagam Vedi, Prakriti Budatad, Tat Pushtigaram Chaiti. From the Charagasamda, we are having the reference. The milk which possesses natural color, smell, taste, and touch evenly mixes when instilled in vessel filled with water, possesses increased strength and health. And according to Harida Samhita, we are having the Shuddhasthani Lakshana or the Mridu Chira. According to Harida Samhita, it is like that. So it is promoting Sattva strength, that is Bala, healthy disease-free stage, that Arogyavastha, and promoting complexion and personality, Rupavan. In concept of Dushtasthanya, factors behind vitiation of Sthanya, one is personal, next familial, social, and economical, and educational. That is personal, you can have the food and habits of the mother, familial stress, non-cooperation from the family members, and social factors like stress and customs of the family, etc. And economical factors that includes the poverty, malnourishment, and education, lack of awareness. Sthanidrushti and diseases of child. Viruddhahara Bhojana, incompatible food intake, Shuddhita, Vichetasaha, and Pradushta Dhadu and Garbhini. So the concept is Viruddha Ahara Bhojana, it take of incompatible food by the mother, and when she is hungry, and Vichetasaha, maybe the psychologically compromised mothers, and Pradushta Dhadu, vitiation of Dhadus will be, and Garbhini. Lead in the diseases like Fakaroga due to the Chiraja Fakta, Parigarbhiga, Kumara Shosha, Chira Alasaga, Charmadala, etc. Expanding or explaining the case of dosha, Tushtasthanya. So Ahara and Vihara of mother vitiates Rasadhadu, dominance of doshas in Rasadhadu, so the vitiation of dosha, Lakshana and Sthanya, and manifestation of diseases in both child and mother. The manifestation of vitiation, you can see, mentioned by Acharya Harida itself, based on the quantity and physical qualities of breast milk, dense milk, that is Ghana Chira, oat milk, Ushna Chira, sour milk, Amla Chira, scanty loss quantity of milk, Alpak Chira, and alkaline milk, that is Chara Chira. Then coming to the Dosha Dushtasthanyas, Vada Dushtasthanya, according to Acharya Charaga, Vairasya, Phenasangada, and Duksha. So Vairasya is abnormal taste, child becomes Chira, child becomes Krisha, very weak and thus growth gets impaired. Phenasangada, excessive froth, the child voice becomes Shama, that is feeble. Baddha, Vidmutrata, that is stool, urine, and flatus are retained. Suffers from Sirodoga and Pinasa. Then Duksha, rise of the Sneha of milk, and child attains reduced strength. Pitta Dushtasthanya, Vivarnada and Dorganthya. So Vivarnada, because of the intake of Ushna, Kadu, Lavana, Ahara, hot items, Rasa reaches the seat of the milk, Durasthana, and produces the discolored milk such as Neela, Pita, and Asida. If the child consumes such milk, there will be a discoloration of the body, and the child will also suffer from Sweda, Adhikya, Trishna, Atisara, Ushna Sharira, and Durgantha, intake of Pitta aggravating factors producing Durgantha, foul smell in the milk. If the child consumes such milk, the suffering from Pandu and Kamala. Kabadushtasthanya, there is Snigdha, Pichila, Guru. So Snigdha, intake of Snigdha, oily and fatty food items. Rasa reaches the breast of the woman and makes Sthanya to Guru and Snigdha and sumptuous. The child suffers from Chardi, Lalasrava, Nidra, Klama, Shwasa, Kasa, Prasega, and Tama. Pichila, when the Kabha vitiated, it makes the breast milk Pichila, slimy in nature. The child suffers from excessive salivation, Chuna Vaktra and Akshi, swelling of the face, dull and eyes, and Jada become inactive. Guru, intake of Guru, heavy ahara, it brings quality of Guru, heaviness in the milk. Child who consumes the kind of milk will suffer from Hridroga. Then reason for Kamba dominance, you can see, shoga that can lead to agnimantya, ahara such as excess madhura, lavana, amla rasa with divasapna leading to malarupa rasadhadu vriddhi, leading to amavastha resulting in kumara shosha-like conditions. So then next is reason for vada dominance due to lankana, ayasa and nisha jagara, rasadhadu vitiated with vada, leading to dhatu kshaya and sthanyanasha. Reason for pitta dominance, krodha, kadu, amla, lavana, ahara, pitta vriddhi in rasadhadu, pitta vikrita, sthanya. Then evaluation. Vada dushtasthanyam, plain water test. Then that Utplavadayam, if a drop is added to glass of a clean water, it floats on the surface. It having kashaya, phenila, ruksha in nature, kashaya in taste, froth and ruksha. And clinical features in child will be varcho, mutra, vibandhaka, constipation and incontinence of urine will be seen. Vaitikasthanya dushti, pitad, usna, amla, kaduga, pidaraji, apsudaga. Plain water test produces yellow lines. Characters of milk will be Ushna, Amla, Kadu in taste. Clinical features in child will be Daha, that is burning sensation. Kabajasthani Dushti, Kabad, Salavanam, Sandram, Jale Majadi, Pichila. Characters of milk salty in taste and slimy. Pichila in consistency. Plain water test things when it poured in water, 30 consistency will be there. Clinical features of the baby. The features are well explained in Charaka Samhita. Shlashmika vigaras like Swasa, Kasa, Lelalu, that is dribbling of saliva will be, and excessive sleep in baby as well. In the Chikilsa, in Shirada, and it is practically treatments are given for the mother, and Stanaleva Aushadas are also given in Shirada. In Shiranada, treatments are possible in both child and mother. Treatment for mother, Sudiga being a stage of Prachalita Dhadu and not considered suitable for the Tikshna Shodhanas. Treatment includes both Shodhana and Shamana therapies. Vamana, Virajana and Astavana are the treatments of choice. Ajara Kashyap mentions the remedies as Kashayapana, Vamana, Virajana, Patyabhojana and Vajigana Siddha Sneha for the remedy itself. Tatra Vadatmage Stanye, Dashamulam Treham Pipet, Athava Agnivaja Pada, Kaduga, Kushta Deepyakam, Sabhangi, Sarala, Vishigali Kanoshadam, Tadaha Pibed Anyadamam Vada Vyadiharam Krada. The Shamulak Vada is to be administered for 3 days. It gives sufficient Kabha Vadahara action, Kabadosha, due to the Sthana Samsara of the Sthanya, Snehana, medicated ghee suitable for Vadahara properties to be administered. Example, like Rasna the Shamula Krida, Vidarya Dikrada. Pitta Dushte, Amrda Abhiru, Padoli, Nimbachandanam, Dhadri, Kumarascha Pibed, Kvadhaitva, Sasharipam. Both mother and child should be made to drink Kvadha of Amrda, Abhiru, Padola, Nimba, Chandanam, and Sharipa. Virajana is a method of application. Then Kabhajasthanya Dushti treatment, the clinical picture of Kabhajasthanya will be so severe because Pilya Dosha, Dushya, Kala and Sthanatva. Kabha is the vitiated dosha. Sthanya is the Ubadhadu of Rasa having Asraya Bandha with Kabha. Sthana as the seat of Kabha, that is Urasthana. Kabha predominant age, that is Bala for the child. All the factors make Vamana inevitable in the treatment of mother for excessive Kabhadushta Sthanya. Treatment of the baby, Snehanam with the Yashti Madhu, Hridam, Yashti Siddha, Hridam mixed with the Saindhava. Then Vamana is indicated for baby also. Radha Pushpa is Tano, Limpeda, Shishoscha, the Sinachado. Ashtanga mentioned the external application of that medicine over these Tanas. Madanaphala, Kalka is to be applied around the nipples of mother or in mouth of the baby. Later, Samsajana Karma is to be followed with Vajati Gana for both baby and the mother. Then considering the treatments of recurrent upper respiratory tract infections in children, typical diseases with the dominance of Kabadosha, it can be Shiraja Fakka, Kumara Shosha, and Shira Lasaga. Samsarga and Sannidushis are also mentioned. Samsarga Lingam Samsargad, Sansrishta Lingam Samsargad, Trilingam Sannipadigam. Samsargaja, Sanivadiga, Dushtasthanya shows features according to the doshas involved. Treatment also follows the same vitiated dosha dominance. And one Graha Dushtasthanya is mentioned by the Kashyapa Acharya, Shaguni Kadutiktage, Skanda Shashti Graho Nyayo Vyabane Sanipadige, Pudana Swadu Kadage Shesha Samshrishta Doshajaha. When grahas are affected to the breastfeeding mother, and they will show the features of Graha Dushtasthanya, the Shaguni, Kadu and Tikta, Shashti Graha, Sanipadiga Dushti, Skanda Graha, Sanipadiga Dushti will be there, and Pudana Madhuram and Kadu. One more, Abhigadaja Sthanya Dushti is mentioned by Madhavacharya. And features of the Abhigadaja Sthanya Dushti is correlated to Vadiga Sthanya Dushti Lakshanas. Treatment principle can adapt. We can adapt the concept of Jwara here and Rasadhat Dushti and Sthanya Dushti. Unless the concept of treatment relating Jwara Chikilsa, Sama Jwara, where the Kashayapana, Vamana and Mrudu Virajana can be applied, Jirna Jwara, Snehana, Rasayana and Vajigana can be applied here, Patya Bhojana as Nidana Parivarchana. So we can have a practical demonstration of examination of breast milk. We can play the video and see how we can analyze the quality of breast milk. Okay.
Due to technical issue, we are unable to continue the session today. The sessions will be continued tomorrow. And once again, thank you, Dr. Shaju sir, for your analytical and practical approach. And the call is now open for discussion. We welcome everyone to please unmute and share your response or share in the chat box. Once again, I emphasize that the rest of the session will be continued in the next day. And with that, we conclude day 1 of World Breastfeeding Week 2025 webinar series. We sincerely apologize for the technical issues from our part. And a sincere thank you to all our esteemed speakers, dignitaries, for sharing your wisdom and guidance. Thank you all participants for your presence and for making this session meaningful and impactful. We look forward to see you all tomorrow for day 2, where our honorable speakers will cover preconceptional, antenatal, and postnatal care to support lactation with case discussion. We hope you found today's session insightful, and once again, thank you everyone.
Okay, thank you. Thank you, Amna Gafu, for the wonderful involvement in the program.